Hello, I'm Zachary John, and today I'm going to be talking about Chapter 11 Techniques for Teaching Children with Hearing Loss. And today, what I'm going to discuss to you guys is the definitions, causes, and types of hearing loss, taking a visuals perspective, impact of hearing loss on development and learning, communication approaches, involving families, multiple strategies, effective occlusion approaches. So definitions of hearing loss. There's three. So there's a lot of models. So I'm going to go and describe each one. There's the socio-cultural model. Deaf people regard themselves as members of a cultural and linguistic minority that are bound together by the use of sign language. Medical disability model. In this model, deafness is viewed as a condition that must be fixed. Normalization is considered best achieved by auditory and speech therapy. Deaf. When capitalized, the word implies a person with a hearing loss who uses American Sign Language as his or her primary language and shares common values, rules of behaviors, and traditions. Continue. Deaf. When spelled with a lowercase d, this term refers to the actual condition of hearing loss. Deaf culture. This term refers to the traditions, language use, and shared experiences of people who are deaf. American Sign Language, or SAL. This is a language used by the majority of deaf people in the United States. Sign language. This is an all-inclusive term indicates some form of visual communication such as signed English in which signs are put in English word order and some elements of the English language are given an invented sign. Hard of hearing. This term refers to a child who has enough hearing that he or she is able to learn language primarily through the auditory, verbal channels without intensive special instruction. Hearing impaired. This term is used to indicate a person with a hearing loss. Cochlear implant. This is a surgically implanted electronic device that may allow a person who is deaf to hear the auditory signal at near normal levels. Causes and types of hearing loss. Deafness or hearing loss does not cause delays in cognitive, social, emotional, visual, and motor development, but the inability to hear may have a profound impact on communication, the acquisition of language, academic achievement, and family relationships. Hearing loss falls into two categories, non-genetic and genetic. The most common non-genetic causes are infections such as rubella, meningitis, ototoxic drugs, prematurity, and noise-induced hearing loss. Prelingual hearing loss occurs before a child has developed speech and language, and postlingual hearing loss occurs after that time. About one-third of the cases of childhood deafness involve genetic causes that include syndromes that present deafness with other medical or physical differences. There are three types of hearing loss: sensorineural, conductive, and mixed. And I'm going to talk about each one. Sensorineural loss is caused by a problem in the inner ear, cochlea, or auditory nerve. This kind of hearing loss is characterized by a decreased sensitivity to sound and a decreased clarity of sound. Conductive loss occurs in the outer or middle ear and may be corrected with medications. Antibiotics for otitis media or ear infections, for example. If treatment for a conductive hearing loss is delayed, a permanent hearing loss may result. In a young child, it can cause delays in speech and language in a short period of time, so teachers and parents have to be prepared and ready. Mixed loss has both sensorineural and conductive components. A child with mixed hearing loss may experience difficulties with both loudness and clarity of sound. In early childhood, ear infections are a common occurrence. Severity of hearing loss. Hearing loss can also be described by the severity of the loss, or how loud a sound must be at different pitches before a child can hear it. There are terms such as slight, mild, moderate, severe, and profound for hearing loss. Visual perspective. A child who is deaf or hard of hearing is a visual person. 90% of parents of young children who are deaf or hard of hearing are hearing. So, based on this statistic, educators, professionals, and parents, we need to modify all interactions with children that have hearing loss to encompass visual and auditory means of learning. American Sign Language is popular with parents that are deaf and the children that are as well. Impact of hearing loss on development and learning. One can never predict exactly how deafness will affect an individual. Outcomes depend on many factors such as the age of onset, the age at which intervention was begun, the use of hearing aids, the quality of sign language a child experiences, the presence of other disability conditions, and the family's socioeconomic status. According to the annual survey of deaf and hard of hearing children and youth of 2004 to 2005, conducted by the Gallaudet University Research Institute, there are approximately 37,500 students who are deaf and hard of hearing in the U.S. in pre-K through 12th grade programs, or 1.5 per 1,000. Approximately 60% of these students are categorized as hard of hearing, while the remaining 40% are considered to have a severe to profound hearing loss. Children who are identified by 6 months of age and receive appropriate early intervention services are 2.6 times more likely to have language skills at or near the typical range than children who receive services later. Also, children who have hearing loss that are enrolled in early childhood education tend to have better development skills in certain areas. Communication approaches. In reality, no one approach is best for every child with a hearing loss. The vast majority of professionals acknowledge that sign language and other forms of visually based communication do not negatively impact the development of speech, but rather appear to boost the development of language. There are 4 communication approaches available to parents and their children who are deaf or hard of hearing: monolingual, language mixing, cued speech, and bilingual. Monolingual. Auditory verbal A through V and auditory AO are 2 approaches to communication that emphasize the speech and auditory pathways, also known as the oral approach. In this approach, 100% of the time is devoted to developing speech and auditory skills. Both of these methods require hearing in the speech frequencies, aided or with a cochlear implant, in order to be effective. Language mixing. The goal of language mixing approaches is to develop English language proficiency and to support speech. In these approaches, speech is considered to be the primary means of communication, with signs providing the visual support. Cued speech. This approach relies on handshakes made near the mouth in conjunction with the lip movements of speech in order to provide a visual form of the spoken language, whether English, French, or Farsi. Cued speech is also considered by some to be easier for hearing family members to learn. Bilingual. Bilingual bicultural programs use the language of the deaf community at ASL as a language of instruction and teach English through reading and writing. Involving families. Regardless of the challenges for families, the benefits of early intervention services and the benefits of family involvement in positively impacting the development of children with hearing loss are well documented. It has been shown that families who receive early services may have less stress and are better able to adapt the language and communication styles to the needs of their child. So, quick note, basically, if you have your child enrolled in early intervention services, the better they are at learning and their development will progress better. Strategies for parents and educators. Auditory development. Speak near the child's ear, draw attention to sounds, gain the child's attention before speaking, etc. There is more in there. Environmental modifications for improving auditory communication and learning. Sit on the side of the child's better hearing ear. Provide a visual link to the source of the sound, reduce background noise, etc. Sound localization skills. Pair visual regard of a sound-making toy or object with the sound from that object. Play find the sound games and provide cues to sounds. Environmental modifications for supporting sound localization. Noises are easier to locate when they're on the side of the better hearing ear, and sounds are easier to locate when they are close rather than farther away. Also help children follow a conversation. Responding to sounds. Read the child's cues related to sounds. read word to help the child understand, provide wait time, and encourage exploration and experimentation. Environmental modifications to aid appropriate responses to sound. Use picture cues, provide correct lighting, pair a sound with a visual cue, etc. Imitation of sounds. Wait for the child, provide many opportunities for repetition and context, and prioritize keywords for the child's routines, favorite objects, and activities. Effective inclusion practices. The most effective environments for children who are deaf or hard of hearing have the following 5 characteristics. 1. The child with a hearing loss has full access to language, including direct communication with the teacher and peers in the child's preferred language. 2. The program attempts to include deaf role models and peers for language and positive self-image development. 3. The classroom is a visually rich environment with many avenues for accessing information. 4. Personnel who are responsible for implementing the child's educational program are knowledgeable about children who are deaf and their needs, including the needs of their families. 5. Appropriate accommodations are made in the classroom to maximize the child's auditory skills, such as acoustic tiles, carpet, and drapes, and assistive technology is made available on an individualized basis. So my discussion question to you guys is, if you have a child in your general education classroom that is deaf or hard of hearing, what strategies and methods could you implement to help the child achieve success? And here is my references, which mostly I got from the book. And that concludes my presentation. Thank you so much.